Us it a little bit here. So
okay, so what we can do is, it's a really simple product. This is on an app. You can download it on your phone, and this will connect with any phone. So you can have one in your clinic that you can use on any patient that comes in. So they just connect this via Bluetooth to your phone or your app, and you can adjust this threshold of sensitivity. So tighten your muscle up, squeeze really hard. You see she's got a really good contraction. Now relax it. And we set the on and off time to, 10 seconds on, 10 seconds off, and we cycle that back and forth over a 10-minute period. Tighten up again, squeeze hard. Now we're gonna make it harder, and she's gotta make a little bit harder contraction, Becca, to keep that up there. Now squeeze hard. Come on, pull hard, hard. So that's her threshold.
And she can see the color, and if it's yellow, you say squeeze more. And
so
she's definitely gonna try harder.
Hit the play button here, and it says relax. Just hold it there for a second, you can see it. And then it'll say flex in a second, and then she'll flex.
Oh, I see, yeah.
Squeeze hard now.
Oh, sorry.
Force the back of your knee straight and keep that light full. Keep it full all the way, pull hard. So it helps with quad re-education. In this case, it helps with extension also.
No doubt, she just had 20 degrees of Rica bottom there.
Exactly. So then the other thing we can do with this is we can play a game. So we're gonna adjust this to make it a little bit easier to play the game. So the game is something that everyone enjoys. So we've got a little bicycle. This is our first game that we've developed. And so squeeze your muscle. Okay, so you get the bike to go up in the air. Hold it there. All right, so you're fixing to go up the ramp. Tip it up so the cameras can see it there. Squeeze hard. You got to keep it up there to catch all the stars.
So she's keeping her quad
She's keeping her quad. Now relax it a second. And so you can go back down and squeeze hard, hard, and rest. Okay, so our patients love this. They're extremely compliant. It helps with muscle re-education, and not only for rehab, but I've got some strength and conditioning people that are coming in that are really interested in this too.
That's pretty neat.
It's great for core strengthening. You put on the abs, and you try to brace with core strengthening. Well, you can actually see how well a job you're doing with that type of activity.
And it's 2 channels too, right?
Yes, 2 channels. So this is a 2-channel biofeedback, and we actually have a neuromuscular deficit test that you can perform.
So it also gives you some quantified data.
Exactly.
So it's objective too.
So that's
pretty cool.
That's the only thing that I know of out there that objectifies neuromuscular deficit.
Right. So man, you're doing a strength test with somebody. You can have this on their muscle groups, and you can almost quantify exactly.
And we do it in the post-op
happening.
clinic. I work with Dr. Lowe in Houston every Tuesday morning. We do our recheck thing.
Right.
And so our next step is to figure out how does that strength deficit on the Biodex correlate with our neuromuscular deficit.
Right.
So some people are a year post-op and they still have atrophy. Well, maybe they have not learned to recruit their motor units and completely, complete the process of branching all the roots out from the tree.
That's super interesting.
So that's another.
And think about it, guys, with 2 channels, this is the part that I love, with 2 channels, you can do things like you can put it on the core during some of our functional core stuff. You can put some pads on your rectus and some on your obliques. You have all those people that are so anterior dominant, right? And they're not getting a good contraction all around. Or how about in a bird dog position, you wanna activate more glute and less low back, right? So you can put some on the hip, you can put some on the low back and say, hey, make the left side go up and the right side stay down. I mean, that's super cool, Russ.
And the other thing we can do is track your session. So this tracks, the amount of work, so to say, in electrical activity done over a 10-minute period. So you can track the progress of your patient to see, how they're improving. And patients love this because